Teeth grinding is one thing that will drive a lot of people crazy. Not just the patients that are struggling grinding their teeth, but also the dentist or the doctor that they go to. Because a lot of times there's no simple solution to fix the teeth grinding. And I see this all the time. I see patients come in and they have a lot of this wear on the teeth, where we see a lot of these divots, or a lot of their teeth are just getting shorter and flatter. And right away when I see a patient like that, two things jump out at me. Either I see someone that is grinding or clenching their teeth, or I see someone that has GERD or acid reflux, or someone that drinks a lot of acidic beverages. Because both of these things are doing the same thing in the mouth. They're both causing damage or wear to your teeth. Now they might present a little differently when they actually come in to the dentist and I actually see which teeth are being affected and where they're being affected, but in general, they're doing the same things to those teeth. But today I'm just gonna focus on grinding your teeth. And I'm gonna approach this from a dental and a medical perspective so that you can naturally stop grinding your teeth and get the best treatment possible for you. So first of all, how many people actually grind their teeth? Well, if you look at some reports, it'll only show you about 8 to 10% of people know that they grind their teeth when they're sleeping. But I'll tell you right now that that number has to be way higher than that, because I see a lot more than that in my practice, and a lot of my colleagues will say the same. And also what we know is about 60% of the population has those movements in their muscles, where their muscles start moving back and forth to grind their teeth, but they just don't actually grind their teeth. And the reason is people who actually grind their teeth, those movements that they get from their muscles are way more extreme and way stronger. So what exactly is causing someone to start grinding their teeth all night long and cause these chipped or these cracked teeth and cause this jaw pain or these headaches and all these other problems? Well, for a while, all we were told is that it is stress related. If someone is super stressed out, then they are grinding their teeth. And that's pretty much all we know. Well, we know that that's a factor, but if you really dive into it more, you'll see that there's a whole lot more into it than just someone being stressed out and causing them to grind their teeth. Now we're finding a big link between sleeping issues and people grinding their teeth. And we're finding that grinding your teeth is actually a sleep-related movement disorder. So what the current research is showing is it's linking grinding your teeth at night to these microarousals while you are sleeping. So what exactly is a microarousal? A microarousal is basically a very brief moment where you are waking up in the middle of the night, but it is so brief that you will not remember it. So you're basically waking up for a really short amount of time and then going back to sleep, but you won't remember it the next day. But these microarousals can cause a lot of problems, not just with you grinding your teeth, but also with your sleep and your health in general, because it can increase your heart rate, it can increase your breathing rate, and it can make you more stressed out, and it can also make it so that you're not getting good quality sleep. But let's take it a step back. So what exactly is triggering that microarousal in your sleep that's causing you to start grinding your teeth? So I made a little flow chart here to help show what exactly is causing these microarousals. Now this is gonna be exactly what's causing your teeth grinding in at least 50% of people. So not everybody, but at least more than half of you. So it starts off as a sleep apnea or a hypopnea. So if you haven't heard of sleep apnea before, that's basically where you stop breathing or you have a really restricted amount of breathing in the middle of the night. So once your body stops breathing or you have this reduced breathing, your body wants to increase its breathing to get more oxygen. And in turn, when you're fighting to get more air into your lungs, your heart rate starts to go up. And once your heart rate starts to go up, that's when you have this increased brain activity and you get that microarousal where you wake up a little bit. And in turn, that causes you to start grinding your teeth because it starts activating your muscles. So I know that this can get really confusing and you might be getting even more stressed out hearing this because you're like, how am I going to control all of these things when I'm sleeping? Well, really, I just want to go back all the way to step one and focus on the sleep apnea that's causing all this downstream other effects. So does this mean that if you grind your teeth at night that you automatically have sleep apnea? Well, no. Like I said, this is the case for at least 50% of people, but it's not the case for everybody. But we're finding a huge link now with these sleeping issues and your teeth grinding. So right away, if you are grinding your teeth, it would be a very good idea to get a sleep study and see if you have any sleep apnea. And we actually have proof that simply treating the sleep apnea can directly stop the teeth grinding. So there was a study where a guy had both sleep apnea and teeth grinding, or in other words, bruxism. And they treated him with a CPAP, and they wanted to see if that improved his teeth grinding at all. So before he had any sort of CPAP, he had 67 grinding events at night. So that means that throughout just one night, 67 times throughout the night, he would start grinding his teeth back and forth. As soon as he got the CPAP machine, his teeth grinding magically stopped. So this is just some further proof that your sleep apnea or sleeping issues is what's causing this teeth grinding. And treating the sleep apnea can actually fix it. Now, there are other ways to target your sleep apnea without doing any sort of surgery or even getting a CPAP machine. Now, I know some dentists will talk about doing what's called a mandibular advancement device, where they're basically pulling your lower jaw forward to create more space and more room for air to come into your lungs. But I'm not going to talk about that. I'm going to talk about two very specific things. One is using a mouth tape at night, and the second thing is using a nasal dilator or a nasal strip that helps open up the air in your nose. So I talked about this more specifically in a different podcast. I'm going to put a link to that in the description below so you can learn more about it. But what we're finding is that simply improving your ability to breathe through your nose can not only improve sleep apnea in some cases, but also potentially fix your sleep apnea altogether. So in one study, they took these healthy people and they wanted to measure their airway resistance when they were sleeping. And they were comparing this airway resistance when they were breathing through their mouth versus breathing through their nose. What they found is by simply inducing them to breathe through their mouth, it caused them to develop very severe sleep apnea. So before the study started, they had no sleep apnea whatsoever. But then when they became mouth breathers at night, they had an AHI score, or an apnea-hypopnea score, of 43. Your AHI score is basically a measure of how severe your sleep apnea is. So if it's a score between 5 and 15, it's considered mild sleep apnea. If it's 15 to 30, it's considered moderate sleep apnea, and anything over 30 is considered severe sleep apnea. So these guys developed a score of 43, and then when they were nose breathers, their score was only 1.5. Now here's another study that was also showing that simply improving your use of your nose while you're sleeping can potentially cure your sleep apnea. So this study took these people that had moderate sleep apnea, and they put them into two groups. So one group, they put this nasal decongestant spray in their nose, and they had them wear this nasal dilator strip. And the other group, they just put a placebo in their nose. And they were comparing their sleep apnea scores. What they found is the group that had the nasal decongestant spray, their mouth breathing was reduced a ton. So the placebo, they were breathing through their mouth about 39% of the time. And the group that had the decongestant spray, they only breathed through their mouth 8% of the time. And also they were comparing their AHI scores. So the group that had the placebo, their AHI score stayed the same, but the group that had the nasal decongestant spray and the nasal strip, their AHI scores dropped on average of 12. So that means that these people who had moderate sleep apnea, they were dropping to a case of mild sleep apnea, and some of them were even being cured of having any sleep apnea. So simply in these people, getting one of those nasal dilator strips from Amazon and spraying that nasal decongestant spray before they went to sleep potentially cured them of having sleep apnea. And we also have studies that show that simply putting a piece of tape over someone's mouth can also reduce their sleep apnea score. So what I recommend is to combine doing a nasal dilator strip and combining that with a mouth tape and seeing if that can improve your sleep apnea. Now, a lot of times when I say that, people say, well, there's no way I can breathe through my nose because my nose is always stuffy or I always have these allergies, etc. Well, again, I put a couple links in the description below where I talked about how you can improve your ability to breathe through your nose even if you have a deviated septum or any allergies or a stuffy nose. I go over all of that in some of my content below in more detail, so make sure you check those out. But there is a specific nose breathing exercise that you can try to improve your ability to breathe through your nose. So basically the way that this exercise works is you're going to take a normal inhale and exhale out through your nose. And then you're going to hold your breath while bobbing your head back and forth. So it's going to look like this. I'm going to keep one finger over my mouth as well so I don't breathe through my mouth. and I keep bobbing my head back and forth until I have this medium to strong urge to breathe. Once I have this strong urge to breathe, I'm going to start breathing through my nose again, and I'm just going to recover for 1 minute. After that 1 minute, I'm going to repeat that exercise, and I'm going to do that same thing for a total of 6 times. So what that does is it's a couple things. So first of all, when you're bobbing your head back and forth, you're increasing the circulation in your nose. But the second thing that it's doing is when you're holding your breath, you're building up a molecule called carbon dioxide in your body. And when you build up this CO2, it acts as a vasodilator. So it starts to dilate everything. And that can dilate the nasal passages and make more room for air to go into your lungs. But also, when you have this increased CO2 in your lungs, it starts decreasing the amount of mucus in your nose. Because your brain has this signal where if you have this increased carbon dioxide, your brain says, hey, we need to improve our ability to breathe through our nose, so we're going to start reducing that mucus so this person can start getting rid of this excess CO2. Now, another way to do this exercise is by, instead of bobbing your head back and forth, you just start walking. So you're going to do the same thing. You're going to take an inhale, exhale through your nose, and then I'm just going to walk as many paces as I can, and then recover again for a minute by just using my nose, and then repeat that exercise 6 times. So the way that I would recommend doing this is using that nasal decongestant spray, and then doing this nose unblocking exercise, and then putting that nasal strip and that mouth tape on before you go to sleep, and seeing if that improves your ability to sleep. Now, if you're still struggling with breathing through your nose, make sure you check out those full videos where I go into more detail in the description below. Now, if you're someone that grinds your teeth, you might be wondering, well, what if it just goes away on its own? Like, what if I just don't do anything about it? Won't it just fix itself? Well, the short answer is no. So there was a study that looked at these people who grind their teeth at night, and they were bringing them in and studying them over the course of many years. And actually, some of the people, they even studied for up to 7.5 years. And what they found is every night that they brought them in for those course of those 7.5 years, every single person was grinding their teeth at night 100% of the time. Now, let's say you did get a sleep study and you know for sure you do not have any sort of sleep problem or sleep apnea, but you're still grinding your teeth. Well, like I said, this sleep apnea may be responsible for more than 50% of the cases, but it's not responsible for 100% of them. So for the other cases, a lot of them can be attributed to stress or a psychiatric disorder. So this study found that people who are more depressive or manic or stressed out or anxious, they tend to have a more increased risk in grinding their teeth at night. And also this study was looking at Israeli pilots, and they were basically comparing the teeth grinding at night of the people who were pilots versus the people who were non-pilots. And they basically figured that the pilots have a more stressful role, so they tend to be more stressed out. And what the study found is 69% of the pilots would grind their teeth at night compared to just 27% of the non-pilots. So this is just some further evidence that the more stressed out you are, the more likely you are to grind your teeth. And that stress does play a big role. And you know, the thing is that this actually makes more sense because a lot of times your sleeping issues can stem from stress. Because when you're stressed out, this is going to drive up your body's sympathetic nervous system. And when you have an increased sympathetic nervous system, this is going to make it a lot harder for you to sleep. And actually, if you look at all of the sleeping disorders that there are, all of them are linked with an increase in people's sympathetic nervous system. Now, the last thing I wanted to talk about that causes your teeth grinding is some medications. Because there are some medications that can cause your teeth grinding, but there's also a medication that may be able to help prevent your teeth grinding. So this study found that people who are taking antidepressants may be increasing their amount of teeth grinding. So specifically, it was looking at SSRIs, or selective serotonin reuptake inhibitors. And this is a common antidepressant that a lot of people take. So the study looked at people and they found that within 2 to 4 weeks after taking this medication, people started grinding their teeth at night. But luckily, there may be a way to fix it if you are taking one of these medications. So one way would be to simply lower your dose of this medication. So talking with your physician, if you're taking one of these antidepressants, about lowering your dosage and seeing if that can improve your teeth grinding. There's also been studies showing that if you are taking one of these antidepressant medications, that adding a different medication called buspirone can actually improve the teeth grinding. So if you're taking one of these antidepressant medications and your doctor says that you cannot lower your dosage, talk to them about adding buspirone. Now, there also is a different medication that can help with stopping teeth grinding altogether, even if you're not on any sort of antidepressant. And that medication is clonidine. So this study found that people who grind their teeth at night, when they started taking clonidine, it actually reduced their teeth grinding by 61%. Now, the problem with clonidine is that it does have some side effects. One of these side effects was that it changed people's sleeping patterns. So it actually lowered their amount of REM sleep and it increased their amount of their stage 2 sleep. But if you look at what clonidine does, it's basically something that relaxes you. So it lowers your heart rate, it lowers your blood pressure, and it also lowers your sympathetic nervous system activity. So this further shows that a lot of your teeth grinding symptoms, the root cause of that is actually an increase in your stress response or your sympathetic nervous system. Now, all of this stuff that I talked about with your teeth grinding was specifically if you grind your teeth at nighttime. If you're someone that grinds your teeth only during the daytime, then that's a little different. So that's usually because you're just stressed out or really anxious. And really the only way to stop that would be to either catch yourself from doing it and stopping yourself, or doing some stress or anxiety relieving techniques. But if you're someone that wakes up every morning and has jaw pain or headaches, or you feel like all your teeth are sensitive or sore, those are all symptoms that you've been grinding your teeth all night. Or sometimes your sleep partner or the person next to you may even catch you and say, "Hey, I heard you grinding your teeth all night. That's super annoying." If that happens to you, make sure you get checked out by a dentist right away, and you may also want to get a sleep study. And you can also try doing some of the methods I talked about already in this video and see if that improves your teeth grinding naturally. Now, teeth grinding can be a huge problem in adults, but it can be an even bigger problem if it's happening in a child. And similar to an adult, a lot of times if a child is grinding their teeth at nighttime, it can indicate that there's some type of breathing problem like sleep apnea while they're asleep. The thing is that sleep apnea isn't something that happens overnight. You don't just wake up one day and discover that you magically have sleep apnea. There's a lot of things that kind of build up that lead to someone getting sleep apnea. So if you treat it properly in a child, you may prevent it from turning into a bigger issue later on in life. So two of the biggest signs that a child has a breathing issue when they're sleeping is when they're grinding their teeth and they're also snoring. So if you hear your child snoring and you hear them grinding their teeth at night, then you want to get them checked out right away. So you can either get them looked at by a dentist, or you can take them to an ENT, an ear, nose, and throat doctor, to get their airway evaluated. So what can cause a child to have these breathing problems while they're sleeping? Well, one of the biggest things that can cause this is how they're breathing throughout the day, and specifically if they are a mouth breather throughout the day. So right now, studies are showing that mouth breathing is reported in at least 10 to 25% of kids while they're sleeping. And of those children, 80% of them will breathe through their mouth during the daytime. What studies are also showing is that mouth breathing in children is one of the first steps to them developing sleep apnea later in life, or some other type of sleep disordered breathing. Basically, the reason for this is children who grow up breathing through their mouth, they tend to develop longer, skinnier, narrower faces with more crowded teeth. And as a result, they have this very narrow constricted airway, or very narrow constricted breathing tubes where they can get air into their lungs. So sleep apnea doesn't just affect people who are obese or overweight. It can also affect people that have poor jaw development. And a lot of our jaw development depends on how we're breathing. So I talked a lot about this in more detail in some of my other videos. So if you want more information than what I'm giving you today, make sure you check out some of the links I put in the description below. But basically, the reason is when someone is breathing through their mouth, they do not have good oral posture. Having good oral posture is one of the best ways to help develop our jaws normally, and in turn, prevent having issues like sleep apnea. So the perfect oral posture is when your lips are closed and your teeth are slightly touching and your tongue is resting against the roof of your mouth. And when you have your oral posture like this at all times, then you're always going to be breathing through your nose. And the other thing is, when your tongue is resting against the roof of your mouth, then that triggers the stem cells in your jaw to start growing wider and forward. And in turn, that helps develop your jaw properly. But instead, when someone is constantly breathing through their mouth, then their jaw is always going to be hanging open, and they're not going to have any stimulus against the roof of their mouth to encourage their jaw to expand and grow. So instead, everything is left constricted and narrow, and also their teeth will not have enough room to grow in the right place, and they're going to be left with a lot of crowding and misaligned teeth. Now, the other problem with mouth breathing is people who are mouth breathers are more likely to get sick, and they're also more likely to have bigger tonsils and adenoids and get those tonsil and adenoid infections. So a lot of times in my practice, when I do my airway exam and I see these bigger tonsils, it's usually people who are mouth breathers. And the reason that mouth breathing causes these bigger tonsils is, one, when you breathe through your mouth, you're always drying out all that saliva in your mouth. And your saliva has a lot of antibacterial properties that can prevent those tonsil infections. But also, nose breathing will directly prevent you from being sick because your nose acts as a big filter. It filters out a lot of the air, it filters out a lot of the dust and particles that can cause allergies. It also filters out a lot of viruses and bacteria that can cause you to get sick. And when you breathe through your nose, it also produces a molecule called nitric oxide. So nitric oxide is a vasodilator and also an antibacterial. So it'll dilate your blood vessels, and it'll also basically clear out any bacteria and prevent you from getting sick. When you get all those benefits from breathing through your nose, it's very unlikely that you'll be getting sick, or you'll get sick very rarely. As opposed to when you're always breathing through your mouth, there's absolutely no filter. So you're basically inhaling all those dust and viruses and bacteria. And you can imagine a kid going to school where they all spread each other's germs around, they're going to be way more likely to get sick, and in turn cause more of those tonsil and adenoid infections. And the last reason that mouth breathing causes these tonsil and adenoid infections is because when you breathe through your nose, you're more likely to engage your diaphragm when you're breathing. Your diaphragm is basically this muscle that rests right underneath your lungs. And when you engage your diaphragm when you're breathing, you're also driving the lymph throughout your body. Your lymph is basically your body's drainage system, and we need it to make sure that our circulatory system is all working correctly. And one of the best muscles that drives our lymph is our diaphragm. Now, our tonsils and our adenoids are big parts of our lymphatic system. So when they're not getting drained, then they're going to be more likely to swell up. So if instead of breathing through their nose, if someone is breathing through their mouth, they're going to be very unlikely to engage their diaphragm when they're breathing. And instead, they're going to take these shorter, shallower breaths with their upper chest. And in turn, they're not going to be draining that lymph from their tonsils and their adenoids. So now you're going to be way more likely to get sick and have those tonsil and adenoid infections, and you're also going to be way more likely to have swollen tonsils and adenoids because they're full of lymph. And this is why a lot of the time, people who are mouth breathers and have these sleeping issues need to get their tonsils and their adenoids removed. Now, this happens a lot in my practice where I see all these signs and I refer to an ENT, and that child comes back to me after having their tonsils and adenoids removed. And a lot of times the parents are super happy because that kid now is sleeping so much better, they're not snoring, their sleep apnea improved, etc. But the problem is that this is only a temporary fix. Removing your tonsils and adenoids will fix the problem temporarily, but it's not fixing the root cause of the problem. And we figured out now the root cause of that problem is having that poor oral posture and not breathing correctly. So it's really important, if your child is having these symptoms, or if you got your tonsils and adenoids removed in your child, to really encourage them to start breathing through their nose and to stop breathing through their mouth at all times. There was even a sleep physician named Guilleminot who said that you are not done treating a child until you get them to stop breathing through their mouth at all times. Now again, you might be wondering, well, what if my child cannot breathe through their nose, or they always have these allergies or this stuffy nose? How can I get them to fix those allergies and fix that stuffy nose to start breathing through their nose again? Well, I go into more detail on how to do that properly in a link in my description below, and I also talked about that earlier in this video. So if you didn't watch the full video, that link is also in the description below, so make sure you check that out. We've all been there. You didn't sleep well last night, so you decided to take a nap, and the next thing you know, you're waking up in the middle of the night wondering what the heck is going on. Or you do decide to nap, you wake up, you feel good, but then you can't go to sleep at night, and then you're just frustrated. Napping can be a great tool if you use it correctly, but at the same